Hi, I'm Costin, I'm from Romania. I'm representing Integration, the first organization made by drug users in Romania 7 years ago. And now I'm in charge with methadone substitution treatment in Bucharest. I'm the medical doctor of one of the centers.
Okay, my name is Marolap. I work for Drug Tax Foundation, which is a website project, international website project, running all over the world, and we're saving the libraries in the drug field worldwide.
Okay.
That's the main point, and I do a lot of advocacy and policy work for governments, especially on cannabis policy. That's it. Okay.
Okay. Are you part of any network or?
Yeah. I'm the technical commissioner of input
Okay.
as well.
Okay.
I do a lot of things. Yeah, so I work directly with input also. Yeah.
Okay.
It's the two things: Drug Tax Foundation and input.
I'm Elliot. I'm from London. I'm the membership secretary of the International Network of People Who Use Drugs. I also coordinate the English language list of input. And I'm the project researcher and project lead on the European Network of People Who Use Drugs, which we have just founded.
Yes.
So that's been my work for the last year and a half. I've been preparing for the founding of the European Network of People Who Use Drugs.
I'm Fabrice from France. I'm running ASUD, Drug User Network of France, and we've been raised since 1992. We made a magazine, and now we are happy to have a national meeting here in Marseille with all the people of input.
Yeah.
Fantastic.
Well, which networks are you involved in?
Input, which is an international network of people using drugs.
Yeah.
And ASUD is self-support of drug user, and we are part of this network.
Yeah. And your input was formed Wednesday?
Euro Input, it will be a part of Input.
Yeah.
It's a European part, and on Wednesday we had a big meeting to fund this network and to target on policy reform, especially because we think that European people need to have focused on policy reform.
Laurent Appel. I'm working for ASUD, Self-Support Use Group in France.
Yeah.
And I'm a journalist also. I'm working for the journal. I'm making also documentaries. And I'm also involved in the advocacy campaign, international advocacy campaign for reform, the drug policy.
Yeah.
That's it.
Which were you part of Euro Input or?
I'm a partner of Euro Input. I'm a partner of Input also, and I'm working connected with the IDPC also.
Okay, and you're from?
I'm from, it's complicated, but I'm French basically.
French.
Part Swiss also, and I'm living in Strasbourg and working also in Paris.
So my name is Arian Botsi. I'm from Albania. I represent here Stop AIDS Association, which is an organization that is totally funded from international donors. As you can imagine from the name, we are working in prevention HIV among risky groups. We are running different programs now, such as Mobile Needle Exchange Program, Drop-in Center for LGBT, lesbian, gay, bisexual, transgender, for prison community, and as well we're offering different options for current drug users. Offering such as safe space or other leisure or other social activities in order to socialize them with the rest of community. We are more focused on advocacy in order to support the efforts that starts from decriminalization and legalization of current illegal drugs.
Well, my name is Eric Schneider. I live and work in Marseille.
Yeah.
I also collaborate a lot with ASUD, French drug users organization, and a little bit with Input, my dear friends from Input.
Yeah.
I do in Marseille, I'm part of a small voluntary organization with lots of harm reduction, but not needle exchange program, more in terms of peer education, counseling, training, also users training, advocacy for users. We work also with inmates from the Marseille prison, and sometimes on European level on various projects about outreach work for drug users and so on. I'm very much involved in the local organizations, community-based healthcare, and also, of course, I'm very much involved in users' rights. This is about what I do really. I'm also sitting on the expert committee about for the town of Marseille about the creation of an injecting room. We don't call it injecting room in France because it's not politically correct, but that's really what it is. Because it has become a very political debate. It's kind of a position where big towns such as Paris and Marseille are self-pronouncing to have them in view of the fact that they exist throughout Europe, for instance. And the central government is saying no. So it's kind of fight, and the central government asked for research to its own agency. Its own agency said it's a good thing to do, and so they put the report aside, and now we have committees, Marseille, Paris, and organizations, mostly voluntary organizations, with politicians actually advocating for this.
Hello, my name is Eva. I come from the Norwegian Association for Humane Drug Policies. In Norway we are working with drug policy change, so we are also invited to hearings for the government when they are making documents about drug policy. We are also doing humanitarian work, so we are giving out equipment in the streets to the open drug scene that are not provided to them through the health system, like ascorbic acid for people injecting heroin, because the citric acid that they use are very dangerous for their veins. Also sterile salt water and cooking devices for heroin. Also we help individual drug users for meetings to the social office, things like this.
And you're part of which organizations or networks in Norway?
Well, we are a part of MCOG, but we are working and some other networks as well, but we are working very, very nationally. So we are working... Should I look at it?
Yeah, it doesn't matter.
Okay. We are working very nationally. With the national drug users and also with national politics, especially.
And the government asks you for opinions, or?
They do. So we are invited to participate in hearings.
I'm Tessa Windelings. I work for needle exchange in the Flemish part of Belgium. So I do the coordination in Flemish part, so a little bit of policy making, a little bit of coaching and stuff like that. So we have needle exchange in every province of Belgium part.
And which networks are you involved in?
We have a network of needle exchange, but we also have a network with the low threshold services, drug services, and we have a connection with outreach services.
And you are here for the conference?
I'm here for the conference as a representative from Belgium.
My name is Matt Southwell. I'm a member of the UK drug user group Respect, and I also work for the International Network of People Who Use Drugs.
And are you part of the European input?
Yes, I'm very pleased to be one of the founding members of the European Network of People Who Use Drugs, which is showing drug users from one of the places where drug user organising first started and developed. It's very great time to be forming a specialist network.
And which organisations are you part of in Great Britain?
So in the UK, my drug user group is called Respect. This is my main work in the UK.
Okay, thank you.
My name is Rick Lyons, and I'm the Executive Director of Harm Reduction International, which is formerly known as the International Harm Reduction Association.
And Are you part of any other networks or in?
We collaborate with harm reduction NGOs and human rights NGOs across Europe and around the world. So we try to work in partnership with as many groups, drug user organizations, human rights groups, prisoners' rights groups as we can to promote harm reduction and human rights and drug policy reform.
And are you here for Euro Input or European Harm Reduction Network?
I'm just here as a delegate for a change. It's the first time I've been to a conference in a long time where I'm actually just able to go and listen to other people speak, and which was actually a really, really nice thing to do.
Hello, my name is Sergio Rodriguez from Portugal. I'm a drug user activist. I'm a member of organization of drug users in Portugal.
And which networks are you involved in your country?
Activism, and I work in outreach team. I'm a peer worker too.
And you're here for Euro Input or
Yes.
Euro Harm Reduction Network?
Yes.
Both.
I'm Jorge Roque from Portugal. I work with several organizations in Portugal, Diferença Real and ENCODE and Input in Europe. And I'm connected also with several projects in Portugal. I work more in a political level, and I make pressure through the government and João Galão, the director, about our decriminalization projects and the next steps, because the decriminalization is the first step. We need much more. We need a heroin program, we need the cannabis social clubs, and my job is to work to increment and develop those projects. And in the international level to make pressure also in European Parliament, Commission and United Nations.
I work for Apothecom in France. So this is an organization who developed the first injection kit in France with syringes and sterile water, and then the cooker came in a filter. And this kit is distributed by the majority of the pharmacies in France. It's sold for €1 a kit, and most of the syringes in France are exchanged through the pharmacies, and thereafter there's the needle exchange programs, and even the health centers are also obliged in France to give out needles. So even if you go to a detox program, there will be needles there. Okay.